everyone, Kimberly Berg, clinical exercise physiologist in the Rebel Fit Club, the training center for people with Parkinson's. Today we're going to talk about sciatica. Now, if you've experienced sciatica, you know it's very painful. It's a pain that goes down the back of your leg, can go all the way to your foot. It can be tingly, it can be achy. It's just very uncomfortable and can affect your standing, your walking. You just can't get comfortable when that pain is happening. Now, why is that happening? Well, the sciatic nerve runs down the back of your leg from your low back. And so when it gets pinched or impinged, that's when you have the pain going down. So that can be coming from your back, maybe due to degenerative disc disease or a herniated disc. But let's just talk about the other cause of like what we call pseudo sciatica. Pseudo sciatica could be when that nerve is being pinched because of a tight muscle in your hip. And with Parkinson's, this happens quite frequently because the gait is being disrupted by your symptoms, maybe just the lack of arm swing, it can be tremor, that could affect that whole leg. And so if your gait is off, then your hips and your pelvis might become malaligned. And so the muscles are trying to right that, or maybe they're being stretched too much. And right under that piriformis muscle that goes around your hips, that sciatic nerve is right there, and that can get pinched and create that. It feels like something that is a very serious problem because of the amount of pain, when in fact you could do some gentle stretching and get some relief. So that's what we're going to be talking about today, is how to do a nerve glide. So nerves don't like to be stretched, but they do like to find space, and they like to feel like things are releasing and allowing that fluid gliding between the muscles. So I'm going to use a stretchy band today, but the very first part of it, you don't need any equipment. You can do this in bed. You could do it in a chair or on a mat. So let's get started. Okay, so you're just going to go ahead and lay back with the one leg. This is the non-painful side. I'm just going to straighten it out. The other side, you're going to bring up and grab your knee. And this should be about 90 degrees here with this leg up here. Now, if this much flexion on this leg causes you more pain, then you need to back off or lower your leg a little bit until you get so there is no pain. So the nerve is already inflamed and angry. So we don't want to make it more angry. We want to give it space. So you're going to be in this position, and maybe that alone feels really good. And then you can just point and flex your foot, just like that, which is good for ankle mobility anyway. You can also do kind of a little stirring action, so you're getting something in the socket here, just moving and creating that glide. There's lots of different positions. Just remember, keep it pain-free. Now, if you want to go the extra mile after that's pretty comfortable and you want to try the next thing, you're going to take this TheraBand and kind of over your toes, not completely, but over the ball of your foot and part of the arch. And I have a pretty stiff TheraBand that I'm using. So you're going to go ahead and bring your leg up. Now, if you bring it up this far and you're getting more pain, lower your leg, okay? You can straighten your leg if that feels okay. Now, just point and flex. Just go back and forth. Now, if you're in this position with your toes brought and your ankle brought back, if you're having more pain with that, lower it down a little bit. There's so many different ways to vary this. So you just go ahead and do this about 20 times. You could do it a couple times a day, And then just kind of stir and do little circles this way. And you have full control because you're hanging on to the ends. So try that a couple of times throughout the day and see if you don't get a little relief from some of that pain. And of course, if there is something going on with your back, you know, always seek out medical attention. But this is just a nice way to get some relief regardless of the cause. Doing a nerve glide is never a bad idea. So if you like this video, hit the subscribe button and give me a like. And go to my website, rebelfitclub.com, where you can check out the blog section and all the complimentary videos like this one. You can also go to the schedule and see how our program, both in gym and virtual, has a lot of classes offered so that we can reach you anywhere in the world. And we have a recorded library also, so you can exercise on vacation or in the middle of the night if you can't sleep. You can also contact me directly, Kimberly at rebelfitclub.com. I'm happy to get back to you and tell you how our great program can help slow down your Parkinson's through neuroplasticity. All of our workouts are research-based and can really help you live a better life. We have our signature boxing boot camp, drumming, dancing, Tai Chi, yoga, stretch, whatever you're looking for, I bet we have it. So contact me, never lose hope, and go forth and conquer.